Alright guys, this is it. This is your final exam review. So we're going to go through each unit real quick, hitting the high points of what you need to review for. Remember, this test is going to be on Tuesday night. Make sure that you're not late. Bring your Scantron and a pencil. It is completely multiple choice, and then when you're finished, have a great summer. So let's look through this real quick with Unit 1. On Unit 1, you need to know the levels of prevention and some examples. Remember, you have a primary level. This would be like vaccines. Secondary are like pap smears and yearly exam. It's again, primary and secondary are both to helpfully prevent or to do early detection for the secondary. And then tertiary is rehabilitation. This is after the fact, after you've had treatment, and it's to try to prevent it from happening again. Cellular structures, you need to know examples of organelles and their functions. Remember that organelles are little organs like mitochondria, endoplasmic reticulum, Golgi, lysosomes, rough and smooth, ER. There's lots of examples there. Also know on the nucleus that it controls the activities of the cell, and that the mitochondria converts food into energy. So those are the two organelles you need to know specifically what they do, but then you need to know that mitochondria, ER, Golgi, lysosomes, those are all examples of organelles. With cancer, on the stages, guys, make sure that you know the 3 stages in order: initiation, promotion, and progression. But please refer to your notes so that you know what happens in each of these stages. That way that you are prepared for the exam, but make sure you know what happens during each stage, because it may ask you which stage is described here. Well, you need to know what happens during initiation, promotion, and progression. For cancer, there's going to be a couple of questions that deal with patient assessment. So you have to determine which patient needs to be seen first, or which diagnosis needs immediate attention. Guys, on a lot of these patient assessments, if their breathing is an issue, they're not breathing correctly, or they're having trouble, those patients need to be seen first. Okay, they're going to be the most acute and the most time-sensitive patients. Other patients then can fall in behind. So just know, if there's a respiratory issue or breathing issue, those patients need to be seen first. Cellular changes, types, and characteristics. There's more than these 3, but these are the 3 you need to know for your exam. Atrophy is a decrease in cell size, normally caused by disuse. You're not using it, so it starts to atrophy. Hypertrophy is the opposite. It's increasing the cell size. Hyperplasia is an increase in cell number. Genetic disorders with nurse assessments. There's a couple of genetic disorders you need to make sure that you know. Down syndrome is the first. Down syndrome is a trisomy 21, meaning there's 3 copies of chromosome 21. Some of the characteristics of a child born with Down syndrome is they have a small square head, upward slanted eyes, and low set ears. The next one's Turner syndrome. Turner's the opposite of Down's. It's a monosomy, meaning they have 1 copy, which is an 1X. This means they're only going to be females, because in order to be male, you have to have an XY. This is just 1X. Some characteristics of an individual with Turner syndrome is a wide neck and droopy eyelids. Alright, moving on into Unit 2. In Unit 2, you need to know that the general adaptation syndrome, the stages are alarm, resistance, and exhaustion. Again, just like with cancer, you need to know those stages. You need to know these. You need to know what happens during the alarm stage, the resistance stage, and the exhaustion stage. For inflammation, some characteristics of inflammation, guys, of course, are redness, swelling, pain, warmth. However, inflammation can also be systemic, meaning it spreads through the whole body, and one of the indications that this is happening is a fever. So it's wanting the systemic characteristic, which is fever. Also, there's types of hypersensitivity we need to look at here. With hypersensitivity, there's 4 types. Type 1 is like an allergy. This would be like a bee sting. Of course, there's a typo there, but it's a bee sting. A lot of times with a type 1 type of allergy, it could be cause you to go into anaphylactic shock. Type 2 is caused by blood transfusion incompatibility, meaning you have like your type B and you got type A blood. That's the type of hypersensitivity that you would be exposed to. Type 3 hypersensitivity is autoimmune. Lupus is an example. This is where some of your immune complexes build up in certain organs, causing the immune system to then attack itself, the autoimmune issue. Type 4 is a delayed type of hypersensitivity. One of the main examples here is a tuberculosis skin test. You go in, you get injected, you have to come back several days later in order to have it read. Another example of this would be like exposure to poison oak or poison ivy, both of which will cause reactions and they come on later on. They're not immediate. Who's at high risk for impaired immune function? You need to look at this based on their age. Of course, the older they are, the more chances their immune system will be impaired. Are they undergoing stress? Is there a chronic disease? Are there certain medications like corticosteroids? All of those can impair immune function. Host versus graft disease. When we look at host versus graft, this is where the host's immune system attacks the transplanted tissue or graft. A lot of times we call this rejection. We also need to look at some HIV. When we look at HIV, we want to look at characteristics, diagnosis, and treatment. HIV is a parasitic retrovirus. It infects CD4 cells as well as some macrophages. CD4 cells are the helper T cells. A low CD4 cell count lets you know that HIV can be present. It also will indicate AIDS. The way that we treat this is through highly active antiretroviral therapy. It's going to be a combination of drugs that hopefully will help the individual decrease the hopefully this will help the individual fight off the ability of HIV to continue to replicate. It's not going to cure the disease, but it may slow it down. Now, types of immunity, guys, you need to know passive versus active and some examples. With active immunity, this is where the individual creates their own immune response. Again, it could be natural or artificial. If it's an artificial type of active immunity, that would be something like a vaccine. A natural version of active immunity is you were exposed to whatever the disease is, like chicken pox or whatever, and you actually fought it off. Passive immunity is a little different. This is where the patient borrows the immunity. Again, it can be natural or artificial. Natural passive immunity is like breastfeeding. It allows the baby to borrow the mother's antibodies, but the baby's not making them themselves. An artificial version would be like a RhoGAM shot for Rh negative mothers. We actually inject them with some of the antibodies to help protect them, but their body's not actually making them. Alright, with Unit 3, guys, you need to know the normal hematopoietic function, the different levels of each component. What I did here, guys, is I combined the male and female kind of together to kind of help you guys remember. But if these are low or high, there can be problems. So with red blood cells, it should be between 3.9 and 5.7. Hemoglobin should be between 12 and 17.5. The hematocrit should be 35.9% to 50%. White blood cell count should be 3.5 to 10.5, and the platelets should be 150 to 140, or 150 to 450. The next one, what is pancytopenia? Now, guys, anytime you see penia, it means that there's a low or decreased level. So this is a deficiency of all types of blood cells. This includes white, red, and platelets. White blood cell count, of course, the normal should be between 3.5 and 10.5. However, if there's a high white blood cell count, it's higher than 10.5. It's probably going to be where the person's fighting an infection. If a nurse sees this, a lot of times reverse isolation precautions need to be put in place, and this is to protect the patient. It's not to protect the people that go see the patient, it's to protect the patient because their immune system's already busy fighting something off. We don't want to introduce something new like another cold or flu or something like that. Infectious mononucleosis, this is also known as mono. You need to know what causes it. It's caused by the Epstein-Barr virus. Leukocytosis, what does it indicate? Leukocytosis is an increase in white blood cell count. This could be that there's an active infection or inflammation present. Sickle cell disease. Sickle cell disease, guys, is a genetic anemia. It's due to abnormal erythrocytes. The erythrocytes are sickle-shaped, like a crescent moon, and this is due to the hemoglobin not being formed properly. A lot of times patients with sickle cell disease can end up going into sickle cell crisis. These can be triggered by a number of things like dehydration, stress, high altitudes, and fever. So when you're educating a patient with sickle cell, you would tell them to avoid these things. Types of anemia. You need to know the different types. However, pay attention when you're doing your nursing assessment to the symptoms the patient is displaying. Okay? If they're being treated for the anemia, they're probably doing okay. But if some of their symptoms are showing that they're struggling in certain areas, those patients need to be seen first. With lymphomas, guys, there's Hodgkin's versus non-Hodgkin's. The main difference is in Hodgkin's lymphoma, there's the presence of those Reed-Sternberg cells. That's the main difference. So that's what you need to look for on your exam. Alright, hemophilia. With hemophilia, this is another genetic disease. However, it's a genetic bleeding disorder. That means that there's not going to be clotting that takes place properly. It's diagnosed with clotting studies, and treatments a lot of times is just bleeding precautions. Thrombocytopenia is decreased level of platelets. This is also going to cause bleeding issues. It has a low ability to clot. Thrombocytopenia, the main thing with education is they may need to use things like a soft bristle toothbrush to help prevent bleeding of the gums, and also other bleeding precautions. With Unit 4, when we're talking about the nervous system, we see here we have meningitis. You need to know some of the risk factors. One of the main risk factors with meningitis, especially if it's bacterial meningitis, is it's very contagious. So living in a community setting can spread it very quickly. Traumatic brain injuries. There's complications with the brainstem injuries, and this is due to the fact that the vital centers are located within the brainstem. These can affect respiratory functions. They can affect cardiovascular issues. Because if the respiratory problem is there, it could result in death very easily, and so those patients need to be seen first. With other traumatic brain injury, we can see a frontal lobe injury, or if it's removed, it will mostly impair judgment. However, it can also impair things like personality, motor skills, and things like that, but judgment's the one that will be on your exam. The Glasgow Coma Scale, this is concerned with a low score. The lowest score somebody can get is 3. However, you need to pay attention that if a patient's score moves down the scale, let's just say that they were at a 12 and now they're at a 9, there's something going on. Something is causing them to not be as responsive, and it can cause them to be deteriorating. Those patients need to be addressed quickly. With spinal cord injuries, important assessment for spinal cord injuries, a lot of times if it's in the cervical area, you have to be really careful with this. Higher the injury, the more affected it's going to be. This could cause potential respiratory failure like we see with a brainstem injury. Seizures. When we look at seizures, a patient who's recently had a seizure may appear to be drowsy and confused. This is what we call a postictal state, and the patient will have recently had a seizure. When we talk about different types of seizures, there's complex focal seizures. The manifestations are those automastomas. This is where they have those kind of repetitive movements like tapping or clicking of their tongue or something like that, where they do it over and over again, but they don't realize that they're doing those repetitive movements. Generalized tonic-clonic seizures. These are used to be known as grand mal seizures. This is causing stiffening of the muscles, jerking of the extremities, and loss of consciousness. In Parkinson's disease, one thing you need to teach with patients is that they need to take fall precautions. Because with Parkinson's, they are losing their ability to have coordinated movements. Fall precautions are super important. Myasthenia gravis, you need to know the cause. This particular nervous system issue is the destruction of the acetylcholine receptors between the nervous system and the muscular junction. Huntington's disease is another genetic issue. This is caused by involuntary movements. However, Huntington's can also cause dementia. Unit 5 with fractures. With fractures, guys, know the healing stages, the importance of the hematoma and the remodeling. The hematoma is the formation of a blood clot, and this lets you know that the blood supply is intact and it's needed for repair. Later on, you see remodeling will have to happen. This is where osteoblasts come in and they convert the callus back into bone. Osteonecrosis can be a complication a lot of times with fractures. The cause is due to interrupted blood supply to the area, and the only thing that really can be done is surgical replacement. With some fractures, we see that they end up having external fixations. External fixations have a high risk, though, of infection because the hardware is on the outside, which means the skin is also breached and opened, so you have to be really careful of infection. Treatment for a fracture, the first thing that should be done is you should immobilize the joint. You need to keep it still. The reason for this is because it can cause other complications if we don't. Things like a fat embolism, it could cut off blood supply and cause osteonecrosis. So we want to immobilize the joint as quickly as possible. Some major risk factors for fractures are numbness. A lot of times if numbness takes place, that means that there could be something going on, maybe something like compartment syndrome where there's extra pressure that's putting it on the nerves, or actual nerve damage itself. Now, a little bit different than a fracture is a dislocation. The main sign of a dislocation is a deformity of the joint itself. The joint is out of place. Now with bone cancers. With bone cancers, we have Ewing's cancer. This is an aggressive bone cancer. However, it also involves the nerves. That's what sets it apart and makes it different. Osteosarcoma is the most aggressive bone cancer. Osteoporosis. This is a major issue, and this especially in elderly women. One thing we should look at, though, is if there's issues of the vertebrae involvement. This could compress nerves and it could interrupt body functions. Depending on the level, it could interrupt breathing, it could interrupt digestion, movement of being able to control the urinary system. So if the nerves are compressed, it could cause major issues. Some risk factors are advanced age, being female, excessive caffeine, and being underweight. Treatment is proper nutrition, increased physical activity, and safety measures. And these safety measures, guys, are to prevent falls. Because most of the time, the first indication that osteoporosis is present is a fracture. Scoliosis. With scoliosis, we see there's some risk factors, but scoliosis, guys, is a lateral curvature of the spine. One of the major risk factors is being young and also being female. Strains, we want to know what's involved. Strains involve muscles and or tendons. So this is going to be muscle or tendon involvement for a strain. Alright, Unit 6. Unit 6 deals with skin or integumentary system. So we see here with birthmarks, you need to know that moles, when they change, there could be an issue with cancer. So you need to know that if there's changes, it could be an indication that they're cancerous. With burns, you need to know the 3 types of burn. A first-degree burn has pain, redness, and swelling. It's like a sunburn. Second-degree burn is pain, redness, swelling, but there's also blisters present that have fluid in them. A third-degree burn, guys, is a blackened area, charred skin, and it's going to be numb. It doesn't have pain. It's numb because the nerves are involved. With treatment, there's lots of types of treatments. We saw these in your notes. However, these are the ones on your exam. First, put the fire out. That's the first thing you need to do with treatment. And then second, when we look at this, change gloves between different wounds on the same patient. This is to help prevent contamination. So if the person has multiple burns, like on different extremities, when you move from the arm to the leg, make sure you change gloves so you don't contaminate the wounds. With cancers here, we see that there's basal cell carcinoma. This is the most common. However, it rarely metastasizes, and that's important to note. However, malignant melanoma, this is the least common, but it is the most serious, so that's why we normally hear most about it. Cellulitis. You need to know cellulitis occurs deep in the dermis and subcutaneous tissue. Cellulitis is when you have swollen, warm, tender areas due to the infection. Herpes Zoster. This is going to be based on a question for the family or the patient. A lot of times the first thing the nurse is going to ask if they suspect shingles, because that's what this is has the patient had the chickenpox or the chickenpox vaccine. Necrotizing fasciitis, you need to know what causes this. This is a very specific question. It's caused by a group A beta hemolytic streptococcus. So you need to make sure that you know what causes necrotizing fasciitis. Psoriasis, understanding about the disease. You need to understand that this cannot spread to others. It's not a contagious one. Also, the main characteristic is a thickening of the skin. Define pruritus. Pruritus, guys, is itching. Another thing with this is why are secondary infections linked to this? Well, when you scratch, you can break the skin. You can decrease the ability of that first line of defense, and it introduces bacteria or other flora like fungus or viruses into the area. Vitiligo, guys. Vitiligo is the depigmented patch of skin, and it continues to spread as you lose the pigment in the skin. Warts. You need to understand what causes them and the treatment. They're caused by a virus, and they can happen anywhere. They can be treated. You can have a number of type of treatments like burning them off, freezing them off, things like that. However, they may return after treatment. That's what's important to note there. Alright, last but not least, Unit 7. With Unit 7, guys, with pain, characteristics of acute pain. This is looking at patients' vitals. If they're in acute pain, sharp pain, there's going to be a stress response, which means you're going to have a high heart rate, high respiratory rate, high blood pressure, so you should see those signs as a nurse. When we're looking at Unit 7 as well, we talked about retinas and the detachment of retinas. Detached retinas, guys, no pain is normally accompanying them, but there's an increasing dark area in their visual field. This is a medical emergency. Cataracts, staying with the eyes. Cataracts are a gradual clouding of the lens. Switching gears to the ear, otitis externa. This is going to be an outer ear infection. Treatment after removal of a foreign object. A lot of times a foreign object might get into the ear. You want to bathe it with alcohol-based product. Proper ear hygiene is don't put stuff into your ears, especially things like cotton swabs or things like that, to clean them, because you could actually compromise that canal, putting pressure on the eardrum. Otis media, this is a middle ear infection. This is a lot of times what we would call just an ear infection. The main characteristics with this is ear pain and drainage. Some risk factors include child care and group settings, because the more kids are around, increased infection rates. Feeding infants in a supine position, putting them completely on their back. Environmental smoke exposure, and then also history of allergic rhinitis. The whole idea of if they have allergic reactions, a lot of times they can have a lot of ear infections. Premature birth and even ethnicity could be a risk factor. Meniere's disease. Meniere's disease, guys, is characteristic of intermediate episodes of vertigo. Remember, vertigo is like the room is spinning. Also, tinnitus, the ringing of the ears. There's lots of different types of treatment, but on your test, I want to know what diet changes need to be made, and a diet change could be a decreased sodium intake. Now, nursing assessment. With this one, guys, it's going to kind of ask you who's most likely to develop vision problems. A lot of times it's going to be your older patients, and especially if they are displaying presbyopia. Presbyopia is where they have a declining ability to focus, and their eyes are losing that ability, so they're going to have some vision issues. Anytime there's an alteration to your sensory conditions like pain, vision, hearing, equilibrium, there's a higher risk of injury. During eye trauma, what's important? Why is it important to treat this quickly? Well, a lot of times, guys, we want to prevent or limit the severity of visual deficits. We want to prevent damage to their ability to see. So the quicker treatment and quicker things can be taken care of, the less likely they're going to lose their vision. Age-related ear changes. When people start to lose their hearing due to age, how should we speak to those patients? Well, first of all, you need to face the patient so the patient's able to see you. You should also talk slow, and you should talk in a low tone. Now, this does not mean that you whisper. When we talk in a low tone, that means you're going to use a deeper voice. Higher frequencies are harder to hear if you're losing your hearing. Conjunctivitis. Conjunctivitis is also known as like pink eye. Precautions due to viral or bacterial infections. It can be highly contagious if it's viral or bacterial. So we want to prevent direct contact. So don't send your kids to school and things like that if they have suspected pink eye. Vertigo. Vertigo is the idea or the illusion of motion that's taking place, like the room is spinning even though it's not. And this is this happens without any kind of stimulation of like motion sickness in the sense of riding in a car or being on some sort of like ride or roller coaster. It's just something they have the illusion of motion. Alright guys, I believe that's all that we need to cover for your review. I know I covered it very quickly, but this should give you an idea of what kind of questions to study and give you kind of a direction. Make sure that you bring your Scantron and a pencil, and if you have any questions, please feel free to email me.